All right, folks, we are back here on Straight Out of the Cannon with me, Scott Cannon. It is 6:47 in the p.m. on Friday, August the 16th, 2024. The future is here. The future is now. And, yeah, I just got done watching the Olympics a few days ago. I love the Olympics. It's probably my favorite sporting event. I usually don't come off as super patriotic during the rest of the year, but during the Olympics, boy, during the Olympics, boy, I'll be up there with my Team USA stuff like So anyway, during their stay at the Olympic Village in Paris, so many of our best and brightest athletes were surprised by the accessibility and quality of free healthcare that was available to them in France. Now, their experience has prompted so many discussions about the contrasting healthcare systems between the United States of America and the rest of the world, practically. The athletes expressed that they appreciated the efficient medical services and how much it benefited their overall experiences at the games. This exposure to free healthcare or should I say universal healthcare, because it's not free, still paying for it, may influence American athletes' perspectives on the healthcare policies back home. Now, the Olympic Village, where these athletes have been residing, began offering free medical care way back in 1932, according to Sports Illustrated. Sports Illustrated also reported that the village offers cardiology, orthopedics, physiotherapy, psychology, podiatry, and dermatology. And this is also being offered to the Paralympic athletes as well. Now, one of our bronze medalists, Ariana Ramsey, who plays rugby, actually was able to get a pap smear. Yes, a pap smear after winning her medal for rugby, and she can't stop talking about it all on TikTok. Like, this sister is happy to be able to finally get some health care. It's crazy to say that she has to do all this for some health care, but hey, this is sort of the country that we live in.
U.S. athletes were stunned by free healthcare in Paris, taking full advantage of something they're not used to back home.
So not only in the village do we have free food, but we have free dental, free healthcare. I literally just got a pap smear for free, and I have a dentist appointment and I exam next week. Like, what?
The Olympic Village offered a wide range of free medical services such as a cardiology, orthopedics, physiotherapy, psychology, sports medicine, and more. Paralympians even got access to dermatology. So instead of the usual post-competition celebrations, athletes were heading to the dentist.
America needs to do better with their healthcare systems. There's no reason why me, an American girl, should be so amazed by free healthcare. And that's what a lot of people are saying in the comments, but like, it is what it is. Of course I'm amazed. We don't have free healthcare in America. So yeah, I'm amazed by free healthcare.
The U.S. is the only high-income country without universal health care. Many American athletes struggle with health care costs, often paying out of pocket. Many U.S. athletes are struggling to afford basic health care on low incomes. 40% of athletes pay $9,200 annually, but only 16% see any reimbursement. Is it time to rethink America's healthcare system?
Yes. Yes. If you listen to the show, I talk about this all the time. This woman also got free x-rays, dental cleanings, a pair of glasses because she has blurry night vision, all free of charge. And she said that the doctors there exceeded her expectations. As you heard in the video, a report found that more than 40% of American athletes paid for health care out of pocket, averaging up to $9,200 per person. More than a quarter of the athletes say that they earned less than $15,000 per year. Good God. In the U.S., healthcare is covered by private insurance that often requires customers to pay out of pocket until a deductible is reached, as well as expensive co-pays and co-insurance costs with extra fees if your doctor is out of network. These expenses frequently make even basic, the simplest healthcare, such as gynecology checkups, extremely expensive. Now, Miss Ramsey has spent the last week or so chronicling her experiences with the free healthcare on TikTok. That's what you heard her in her videos. Now, healthcare in the United States is projected to cost almost $5 trillion per year, according to a recently released federal data study outpacing this country's GDP per person. That amounts to an estimated $14,423 in 2023, with a projected rise to $15,074 in 2024. In France, the host country of the Olympics, that number was estimated to just be $5,740 per person. And so they actually spend less per person because they have a universal healthcare system. The United States is the only country with a high income without universal healthcare. According to this study from the Commonwealth Fund, it is also ranked last overall in providing accessible, affordable, high quality health care, and reported that 38% of Americans didn't receive their recommended medical care in 2020 because it was too doggone expensive. The richest country in the world, folks. The greatest country in the world. Wasn't Joe Biden just lecturing us about how, we can fight multiple wars and at the same time we can keep sending all this money to Ukraine and Israel and antagonize Russia and Iran at the same time? While we're the only high-income country without universal health care. Now, I remember there was a guy who ran his presidential campaign on providing universal health care for the American public. What was that guy's name? I keep forgetting who that was. Oh, man, what was his name? What was his name? Oh, right. Bernie Sanders. I remember his name was Bernie Sanders, and the Democratic Party elites completely rigged the process against him so that he could not win. Hey, keep voting for him. Now, after her experience at the Olympics, Miss Ramsey has said, "I am officially a free healthcare advocate. This is going to be my new fight for action, free healthcare in America, period." And so, what is the toll? What is the toll of America not having universal healthcare? Well, again, you got to go to foreign news sources because our media is just propaganda owned by the billionaire elite class. The Daily Mail, the UK Daily Mail, actually gave a report, actually wrote an article about how the United States, we suffer 1 million excess deaths every year in this country. 1 million excess deaths per year. In comparison with other countries, we could avert 1 million extra deaths every year if mortality rates were on par with the 21 richest countries in the world. This study examined how many deaths could have been avoided over the last 90 years if we had mortality rates on par with other countries. That's right, 1 million. 1 million. 1 million U.S. deaths could be averted every year if our mortality rates were on par with those in the other wealthy countries. Researchers looked at the rate of all-cause mortality per population size since the 1930s in nearly 24 peer nations, including the United States, Canada, Japan, Australia, and 17 European countries. They found that in spite of the fact that the United States of America is the richest country in the world, it suffers more deaths per capita than any of the other rich countries since around 1980. What happened in 1980? Oh my God, what happened in 1980, man? Oh man. What happened? I can't remember. Ugh. Think what happened in 1980 that we talk about all the time that ruined America. Ronald Reagan, he ruined America. Well, I won't say he completely did it by himself, but he certainly is the person I believe is most to blame. The worst thing that ever happened to America, at least over the last 50 or 60, well, I'd say in the last 100 years or so. This study noted that the opioid and fentanyl epidemics, gun violence, and obesity-related deaths have all been a big part of the reason that America is such an outlier in comparison with these other countries. Now, this study was published in Proceedings of the National Academy of Sciences Nexus and found that by 2019, around 600,000 deaths could have been prevented if the U.S. had similar mortality rates to the peer nations. But when the pandemic hit, it skyrocketed to over 1 million. So the pandemic exacerbated an issue that we already had in comparison to the rest of the rich countries in the world. Now, Steffi Woolhandler, who is the senior author and professor at the School of Urban Public Health at Hunter College, blamed America's healthcare system, insurers, corporate greed, and politicians for the avoidable deaths that we see on a yearly basis in this country. We waste hundreds of billions of dollars each year on health insurers' profits and paperwork, while tens of millions of people can't afford medical care, healthy food, or a decent place to live. Boom. Americans die younger than their counterparts elsewhere because when corporate profits conflict with our health, our politicians side with the corporations. And that is both parties. That is both parties, which is why I don't vote for them. Joe Biden said that if universal health care crossed his desk, he would veto it. Kamala Harris actually used to support universal health care when she thought it would help her be more popular like Bernie Sanders, but now even she has abandoned it. They've gotten to her as well. Hillary Clinton was the original universal health care advocate in the 1990s. But they got to her too. By the time she ended up in Congress, she became the person who took the most money from the healthcare companies. And then magically, once she started running against Obama, once she ran in 2016, she was no longer an advocate for universal health care. Now, despite the number of excess deaths peaking in 2020 and 2021, this team from Boston University School of Public Health, University of Pennsylvania, Harvard Chan School of Public Health, and Hunter College found America's excess death rate has worsened since the Reagan era. I wonder why. But this isn't how it's always been. It's important to state this is not how it's always been. In the 1960s and 70s, America's excess death rate was around the same as every other Western country. England, France, Germany, Canada, UK, etc. However, in the 1980s, the number of excess deaths began to rise, climbing approximately to almost 1 million in 2019, and that's before the pandemic. And since the pandemic, it skyrocketed to over 1 million per year. In the years between 1980 and 2021, there were 13.1 missing Americans. 13.1 million missing Americans. That is Americans who should still be alive if it was not for our completely jacked up system. Now, the study lead and corresponding author Jacob Bohr, an associate professor of global health and epidemiology at Boston University, called the number of missing Americans unprecedented in modern times. Nearly half of the Americans who are missing died prior to the age of 65. In 2020 and 2021, a level that excess deaths said was particularly stark. Again, the pandemic hit everywhere, but it killed us because we have such a disjointed healthcare system. The Centers for Disease Control and Prevention reported life expectancy in 2020 was 77 years old, a decline of nearly 2 years from 2019. In 2021, it declined again to 76.4 years. In 2020, 9 of the 10 leading causes of death were the same as 2019, though 5 causes switched ranks. However, heart disease and cancer remained the top 2. Heart disease and cancer. You know, I heard a statistic some years ago that completely broke my heart. And it really drove home how corrupt and immoral our system is here in this country. It is, did you know that the age that has the highest amount of people who are diagnosed with cancer is 65. 65 is the age that has the highest amount of cancer diagnosis. And that is because 65 is the age that most people start to become eligible for medical care. Subsidized medical care. So a lot of these people have age 59, age 60, age 61, age 62, age 63, age 64, known something was going on in their bodies and couldn't do a doggone thing about it because they didn't have health care. And so they had to wait till they were eligible for Medicare and then go, oh crap, now I've got cancer and it's terminal and I got a few years left. That's horrific. That is absolutely horrific. During both 2020 and 2021, deaths among all ages increased year over year, except those 1 to 4 years old. Bohr said, living in the U.S. is a risk factor for early death that is common across many U.S. racial and ethnic groups. Whereas most health disparity studies assess differences between U.S. racial ethnic groups, such as approach renders the poor health of whites invisible and grossly underestimates the health shortfall of minoritized groups. But by using an international benchmark, we show that Americans of all races and ethnicities are adversely affected by the U.S. policy environment, which shows a low priority on public health and social protections, particularly for low-income people. Accounting for the future years lost to someone dying prematurely, researchers have estimated that in 2021, excess deaths translated to 26.4 million years of lost life when compared to other countries that, again, were going through the same pandemic that we were going through. Based on the study results and the trend of excess death in the United States, Mr. Bohr has said that he is not optimistic mortality rates will rebound in the near future, even as COVID deaths fall to some of their lowest numbers. He said the U.S. was already experiencing more than 600 missing Americans a year before the pandemic even started. And that number was increasing every single year. There's been no significant policy change since then to change this trajectory. No significant policy change to change this trajectory. A pox on the House of the Democrats, a pox on the House of the Republicans, and everybody who continues this charade. This is immoral on so many levels. 13.1 million Americans missing Americans since 1980 because, well, I guess by now it would be probably close to 14 or 15 million since this study is a few years old. But it just goes to show you that when you have a so-called democracy like ours that is controlled by corporate money, you don't have a democracy at all. They sell every election as, oh, this election is going, we got to save democracy. What democracy? This is a plutocracy, Holmes, owned by the richest and most powerful people, and they don't give a doggone about you. As the late great George Carlin said, it's a big club and you ain't in it. All right, folks, I'm off my soapbox. Let's change the mood. It's time for the Happy Happies. We'll be right back after these.